The Gauteng Health Department has obtained a court interdict against striking Nehawu members. Health Minister Dr Joe Phaahla and provincial officials visited affected health facilities just this week to assess the impact of the strike on healthcare services. According to Phaahla, 4 deaths can be directly linked to the strike action. For more on this, we're joined this morning by the Gauteng Health MEC, Nomantu Nkomo-Ralehoko, joins us via our video link this morning. MEC, thanks very much indeed for coming onto the program. An interdict has been obtained, and yet the strike, as far as we know, continues.
Yes, we did receive an interdict. But from yesterday, I have to be honest with you, the strike was not intense like it was in the previous days. And we are happy about that because I visited all the centers yesterday, almost all the ones that were the hotspots, if you remember. But in those areas, that's where we realized that at least there is some improvement. And even in Sebokeng, I left there yesterday at 10:30 in the evening. Already there were 80% of workers that were at work working. But what we did again, at 6 o'clock yesterday afternoon, we had a discussion that was facilitated by the Premier between myself and the leadership of Nehawu in the province. And we have agreed on certain things that we must do so that we are able to save lives. Because all our interest now is to make sure that the institutions of health in the province, they do function, even if some of their grievances have not been addressed by the national, because that's a national strike, which is something that we're reminding ourselves about in that meeting, that as much as you are concerned, but remember, this is a national strike, but we can't allow areas like Sebokeng to be shut down completely. Telemoerane in Vosloorus shut down completely. Kopanong, those are the critical areas that we want them to function, and there are patients inside. Some of them are at the high care. So that was the problem. That was the agreement that we all agree that let's come to senses. As much as we are having this problem, that must be addressed, but we must have an amicable way of sorting out our own in the province.
So, Premier, the reason why we're talking to you this morning, even though there are several provinces impacted by the strike, is because Gauteng is the hardest hit by the strike action in the healthcare sector. So yesterday, some hospitals in the province experienced a total shutdown. This was the case at Kopanong, Sebokeng, Bekim Langleni, patients being left unattended there, many patients having to turn around, unable to collect chronic medication. For our viewers who are watching and perhaps who have been impacted directly by the strike action at Gauteng's hospitals, what can you tell us about the hospitals that, as of this morning, are receiving patients?
As of this morning, I can tell the patients that they must go to the hospitals. They are protected. There is security that is there at the gate, and there are people that are working there. What we have done immediately when we saw that now the strike, it's becoming serious on the second day, we activated our command council. We have a team from the national and the province that has been assigned to work in each and every district with the district officials to ensure that things do run smooth. Remember again, in the Gauteng, we have localized our health. So people that are supposed to correct their chronic medication, it's not only in the hospital where they should be. We deliver most now of our chronic medication to their homes at home, because we have mobile units that we have established. For the past 4 months, I'm sure you have seen me going to every area in the province, because in the informal settlements, in the townships, where we're able to localize health issues. And I think this has helped, because most of these services that should be done at the hospital are done at home. Where we have been hardest hit indeed, and there was a total shutdown, it was only in Sebokeng and Charlotte Maclek and Kopanong and Telemoerane, where even our theaters were not working. But we diverted those patients to Barasam and Steve Biko so that they can do those operations that they were supposed to do, that were scheduled to be done on those days. So immediately when we realized that this is going to be a problem, we activated that team, and we have a WhatsApp group that all our CEOs are there. So we're feeding each other with information in showing that where there is a problem, who needs to be attended to, including those that were the labor ward, that delivered, because we were able to deliver people at Gauteng Hospital because the executive was there and some of the team that we managed to get from other neighboring hospitals. Team from Joburg South, which is your South Hills Hospital, the CEO with his team was there assisting patients because he's a nurse himself, and they were even feeding patients from Pethakoa. CEO and some of the team members ran there. Aiden Vale, he had to bring some linen that we've been using, and they took the other linen to go and wash it because we have some washing machines that are bigger than the other areas in Edenvale. So we have this help from those neighboring ones, including Heidelberg. Clinical manager was
MEC,
there.
If I can come in there, please, MEC, because I have a couple more questions that I need to ask you about the backlog that must surely have come out of the protest action from the past couple of days. In terms of that backlog, in a context where hospitals in our province and around the country are already under strain, how do we deal with that backlog as a result of the strike?
On my side, Michelle, because I've said now I'm running this as a project. We have a project team that is running those backlog. Where we have a backlog, we're going to make sure that we ease up that pressure. So, in fact, you remember the backlog that I was telling you recently in a statement that I took out 3 weeks ago on the surgical backlog. We have partnership with medical and with the private sector. They are assisting us in terms of the theatres that we are going to use to ease up that backlog. So even on that side, we have plans already that are in place. We were sitting at 32 when I had that statement. We moved to 28. I've not got the report now because I was getting weekly reports. Now we've been disturbed by the strike. I can't give you the figure now, but I know that we're going down, especially in areas like your cataract, and now where we are knee replacement and hip replacement. Those are the areas that we've categorized them that we will be able to deal with the surgical backlog. Indeed, there is a backlog, you are correct. But now our worry is that even on this one, let's not allow the backlog now to be piled up because of the strike. Hence, we have negotiations of making sure that we divert our patients to other hospitals that will get assistance.
Yeah. Several patients, especially at Charlotte Maxeke, also turned away patients receiving cancer treatment, MEC. As we know is the case with cancer treatment, time is everything. Timing is everything, and getting that treatment on time could literally be the difference between life and death. Is there a focus as well on getting that kind of backlog, insofar as oncology is concerned, sorted as soon as possible?
Yes, you are correct. We are attending to that one at Charlotte Maxeke too, because that's a critical one. You are correct. And it was that day that there was that shutdown, but the following day the ward was open, the hospital was open, so people were able to work. And I think I want to thank health workers that made it a point that although it was difficult, they managed to come and work, because some of them even went to the leaders of the unions at Charlotte Maxeke when they were doing. Some of the matrons went there and tell them that people are dying inside. Please give us some members, even if it's not many. 1 or 2, they must come inside so that they can assist us to work. Hence, it was easier for them to move and start doing some work. But the intimidations at the gates and other areas, because once people see people singing at the gate, even you, Michelle, you will not go to that institution. You will leave, because you will be clear that you are not safe. And I think that's the incidents that you've seen happening even at Bara. Inside, there was nothing, but outside, when now they moved closer to the gate, that's where we had a problem. Then the management had to ask them to move a bit, and that's when there was that confrontation that you saw even at Bara. And we're advising them now that don't go close to the gate, because you are going to make sure that you block the gate and people will be unable to come to the hospital. Let's let the facility open. And I'm happy that they've managed, the leadership of Nehawu in the province have agreed that we will make means. That will not happen. And the police is there in all these hospitals. They are going to help us to ensure that if there is any confrontation that happens, it doesn't happen. Yeah. But the message was sent out yesterday by the leadership with our agreement, and we have a team that is working from my department and the department and the labor that will be working together to clear this thing that is making us not to function properly. Painful thing is that these are the lives. We can't accept that we must lose lives. because of our own minor differences, that we can resolve them on the table.
Gauteng Health MEC Nomantu Nkomo-Ralehoko, let me thank you for your time this morning. In the midst of that, several provinces have successfully applied to interdict that court action, but several analysts weighing in, especially on our show, talking about the fact that healthcare workers have a right to strike, that it cannot come at the cost of patient care, but these are nurses who deserve to be paid what they are worth, and they deserve to operate in hospitals that have the resources that they need to do their job. So certainly it's a developing story that we're tracking for you this morning.